Okay, so now I will introduce another digestive gland to you. That's what we call the pancreas. So pancreas is the longer, softer organ behind the stomach. So that's what we call the extraperitoneal space. So on the back, okay? Pancreatic cancer. Yes, you couldn't find and you couldn't feel something because the position is very deep. So we look at these pictures. Okay, so the pancreas so divides the head and surrounded by the duodenum. Then the neck pass through the common bile duct and the body and the tails. So the tails just nearby the spleen. Okay, so inside we have the pancreatic duct. So pancreatic duct on the right side is combined with the common bile duct. So they open to the duodenum. That's what we call the major duodenum papilla. Okay. So the pancreas is the endocrine gland. It's also exocrine gland. So the endocrine gland, so the pancreas secretes two hormones. Number one is the insulin. Insulin would reduce the blood glucose level, and the glucagon would increase the blood glucose level. Okay, anyone knows diabetes. So diabetes is a shortage of the insulin. So the blood glucose level is very high. So anyone know who take charge of this insulin or the glucagon? Yes, most of them is in the liver. So the liver would transportation by the insulin and the glucagon. So would be reduced or increased blood glucose level. So okay, then we talk about the exocrine function. So exocrine function produce the pancreatic juice. Okay, pancreatic juice is very important. He will digest any food. So actually we have four kinds. So number one is carbohydrate. Number two is protein. Number three is the lipids, the fat, and number four is the nucleic acid. Okay, so it's all digested by the pancreatic juice. Okay, so now we know the most important observation area is in the small intestine, because the food also digested and they can absorbed in the blood vessels or lymphatic vessels. So if something wrong, so for example, gallstone. So gallbladder developed a stone, so would block the bile duct. So the bile would come back to the blood. So our skin would become yellow. So that's what we call the jaundice. Okay. So jaundice is a very important symptom for the patient. Okay. So if someone got jaundice but feel pain, where? Morpheus symptom. So Morpheus symptom is position is on the cost arch and rectums, right position, right point. Okay, so it's the gallbladder stone that you feel pain, jaundice. So if no pain, painless jaundice, yes, I will show you. So it's very dangerous. So see, I already tell you, the pancreas neck, pancreas head, if developed pancreatic cancer, so would develop large, would be blocked the bile duct. So the bile is also couldn't come out, just go back to the blood. So it's also jaundice. Okay, jaundice. So this jaundice is no pain, no feeling. So it's very dangerous. Maybe it's the cancer. Okay, pancreatic cancer. How is the bile come out? How is the bile produced? So as anatomical, I will simply introduction. Okay. So we all know we have the red blood cells. So red blood cells life is limited. Then after that he will die. So would be absorbed the liver or spleen. hemoglobin. So hemoglobin would separate hemo and globin. So hemo would produce, that's we call the bilirubin. So bilirubin would produce the bile. Okay. So now you know the bile came from where. Okay, bilirubin. Now we know the jaundice situation. Number one, the liver problem. That's we call the hepatitis. Number two, we have the blood in the bile duct or gallbladder stone. And number three, so we have the cancer sometime for the pancreatic cancer. Okay, thank you.